Today we're going to be talking about stroke. Unfortunately, in Indonesia, there's quite a lot of strokes that happen. A lot of people have strokes in here, and we're dealing with a lot of patients that have strokes. We're producing a video right now about a patient that had a stroke. It was a pretty major stroke. This is not the first patient that we've dealt with. So today I want to talk about what happens with the stroke, why the strokes occur, and what do we do with when a stroke happens. First of all, in Indonesia, a lot of people get strokes, unfortunately. Why is that? Number one, does my audience know that strokes usually don't happen in the head directly? A lot of strokes happen in the neck actually first. So many of the strokes happen in the, what we call pembuluh darah leher, so in the neck. So on this picture you can see there's a blood flow that's stopped in the neck, and the blood clot travels to the brain. So that's how you get a stroke a lot of times. It's not directly in the head. A lot of the time strokes also happen in the head. So what are we supposed to do if the stroke does happen? First of all, recognize that it's a stroke. Okay, don't ignore it. Don't say that, oh, maybe it's not a stroke. Okay, I'll give you guys a bad example. My mom, about 2 years ago, she was having symptoms which were really unusual. She started to have numbness in the hand, her face was really sloping on the side, and she called me first. She didn't go to the hospital. I said to her, Mom, this is something is really wrong. You have to go to the hospital right away. And she went to the hospital. Turns out she was having the early stages of stroke. So the good thing is that we treated her right away, and she's perfectly fine now. She doesn't have I think no symptoms at all right now after the stroke. How did we treat her? We applied something called neurophotonic discs. Now on this video you can see I'm applying neurophotonic discs to a patient. You can see the disc on the head. Neurophotonic discs, they can help to improve blood flow, restore and repair blood vessels, and they can decrease the stroke damage. The key to stroke solution is you have to start early treatment. That's the most important, okay? Do not postpone. What are the choices? Some people choose hospital care is definitely a must. You have to stabilize yourself in hospital. You have to stabilize yourself in the hospital. That's the first thing. You go to the hospital, rush over to the hospital if you have a stroke immediately. They will give you the right medications. Once you're out of the hospital, do not just ignore everything. You still have to treat things. Okay, so what do? Number one, some people decide to go to acupuncturists. Not a bad option. There's some science that says acupuncture really helps. Some people decide to come to my clinic. We treat them with neurophotonic discs. What does the neurophotonic disc do for stroke? It decreases inflammation in the brain, improves blood flow, fixing the blood vessel actually. So those are the two main solutions that I found that works best. Yes, medications, yes, you have to take medications, but acupuncture and neurophotonic disc work the best. If you have questions, let us know. If you have somebody who needs help, let us know. We have treated several patients with strokes, and to this point, to this day, really successful treatments. Okay, people really get better.